Good morning and welcome to our guests this morning. My name is Corrine. I'm a gynecologist in Regina, and I was looking for a solution for infection rates in cesarean deliveries. So we do about 1,000 cesareans a year in our hospital, and cesarean deliveries are the most common operation performed. Everything else pales in comparison with regards to numbers. And I regularly was receiving information from our infection control department about our infection rates, even right down to the physician level. But if you don't make a change, you're not going to see any improvement. I also know that quality improvement takes more than 9 months. So this project started long before the CQIP program, and I value the opportunity to have used this time to advance this. So I was looking for a solution, and in the fall of 2016, there was an article that published on adding azithromycin to the usual antibiotics that we use for prophylaxis. And they actually reduced their infection rate dramatically by 50%, from 12% down to 6% for cesareans done in labor, when you would think that there's more infections because of more risk factors. And they didn't have any increase in neonatal complications. So I said, let's go, let's do this, which led to a personal phone call from Dr. Jessie Minion, who said, just wait a minute, Jades. She says it's not been put into the guidelines. It hasn't been incorporated into the Saskatchewan control protocols yet. So why don't you do it as a QI project? And so my response was, really? But it was actually really good advice. So we put together a team. I worked with our infection control department. Jessie helped me with the research application to the ethics board. We got statistics people involved. But really, the team is huge. It takes a village to do this kind of stuff. And I don't do that many cesareans myself. I need my whole department, of which I have one of my lovely department members here in the front row. And not only that, I mean, we work with nurses on multiple areas: fetal assessment unit, labor and birth, mother-baby unit, pharmacy. We didn't use azithromycin in our labor and birth, hardly at all, once in a blue moon. Anesthesia needed to give it. It took an hour to infuse it. So there were a lot of things that needed to be put in place before we actually got to do this. So what did we actually do? Well, we talked about it as a department, and I love my department. They're a lovely group of human beings, and they really take well to somebody saying, let's try this, and they go with it. But there are lots of details to be worked out within the health region, educating staff. How do we get this up and running? What do we do when a C-section is delayed? Do you repeat the dose? This kind of thing. Lots of stuff to work out. But we managed to launch this by August 1st on 2017. So our infection rate wasn't 12%. It was 3.5%. And so we needed quite a few numbers to show it. And we collected data. Thank you, Meredith. I drive with her every time I come to one of these. And the data collection that we took on timing, well, that wasn't quite as accurate. So I worked with various groups to try to obtain the data on, did we actually do what we wanted to do with regards to giving the antibiotics? And actually, they did. These people came along with me. We had 95% compliance in administering azithromycin, and the ones that didn't get it, often it was like a cord prolapse or an abruption or a bradycardia, and it kind of got lost in the shuffle. But did our infection rates actually change? 3.5% down to 3%? Was that really a difference? And so there's different ways of looking at it, and in this program we looked at the data using various graphs, various charting, and unfortunately, it stayed a stable run chart. It really didn't change. So what did I learn? It takes a village. Data comes from many places. I learned a little bit about Excel. I still have a bit more to learn about pivot tables. I'm working hard to get this published. And the biggest thing I learned was don't charge ahead, look at your data. And we actually stopped using azithromycin. So we no longer have the cost and the change to the microbiome and the administration time and all the foo-for-all that goes along with giving another antibiotic. So I'd like to thank the infection control department, especially Meredith, again. Thanks to my department for coming along for the ride, and thanks to the CQIP program for taking me along for the ride this year.